So hello there, my name is Charles. Today I'm going to be talking about the Multi-Specialty Recruitment Assessment. Now, this is an examination that most of you will be able to sit. It's an examination you can either sit somewhere in the middle of F2, or you can take an F3 year and sit it, or you can sit this exam while you're in a different specialty thinking about transitioning to another specialty where this exam is taken. As for me, I chose to sit this exam in the middle of F2. Things you have to be mindful of is the year is going to be busy. You've got a lot to get done, including your portfolio. The other thing, think about how you rank your options. So make sure maybe your first option and your second option are on the lighter side if you plan to revise, especially during your first rotation. I did A&E, so my rotation timetable was a bit crazy, but I still managed to do it, so it's still possible. So things to know about this exam: it's a computer-based exam which is set by Pearson VUE. You have two sections. You have a professional dilemma section and you have a clinical questions section. The first section is about 95 minutes long, the second section about 75 minutes long. You can also apply for extra time if you're entitled to extra time. So essentially, you choose your specialties that you want to apply for via Oriel, and once you send your applications, you will get an email saying you need to sit this exam. It's part of the process. Obviously, there are a range of specialties that require this exam, so you will know beforehand. So for me, the applications that require this exam were psychiatry, GP. Other specialties that other people applied for that require this examination included radiology. For the first section, the professional dilemma section, this is, in my opinion, the same as the SGT exam that you sit while you're in medical school. You have two parts within that section. Part A, where you get a scenario and you have to rank them to the most appropriate and the least appropriate. The second half is you get a set of 8 options and you have to select 3 of the most appropriate options that you would do. The revision tactics that I use for the SGT are exactly the same I use for this section, so that video that I've made on SGT revision will be very useful in this section, so make sure you check it out. You've also had clinical practice at this point, so you should find answering these types of questions a lot easier compared to how you would have found them before you started your foundation training or whatever specialty you're currently on. In terms of the clinical problems questions, so you have single best answers, which is one of the parts, and the other part is you get a set of answers and the scenario is sort of changed. So essentially you could pick the same answer for different questions, but just make sure you've read the questions and you've practiced it properly. So topics covered range from literally every specialty that you had to know from medical school. You need to know that now. So cardiovascular, respiratory, GI, pediatrics, women's health, psychiatry, general practice, emergency medicine, all of those specialties are there. So make sure you revise those specialties. So they'll be looking at your ability to select the correct investigations, come to the correct diagnosis, think about management and prescribing as well. In terms of time to revise, I would probably say you need to aim for about 4 to 6 months. If you're going for 6 months, I guess you want to space it out, go for the more relaxed approach. If you want to do something that's more intense, maybe you could push it to about 3 months. It also depends if you're revising with other exams as well in mind. So for me, I had to do this exam as well as the public health exam. So towards the end, I sort of was splitting my attention between the two, focusing more on the exam which I felt needed more work. So you need to keep that in mind as well. In terms of revision, there's 2 things you can do. You can either read material around all those specialties. So for me, I went to my medical school notes and I was reading through those, as they were quite condensed and quite straight to the point, so they were quite reliable for me. And then after that, I started doing question bank. For me, the question bank of choice that I chose was past medicine. It's one that I'm familiar with. Other people actually vouched for different question banks. Past medicine was not one that was vouched for by many people, but for me it worked. My approach essentially with any question bank is to start generally, try to get through maybe the questions once in all the question bank. It will give you an idea of which areas you need practice on and which areas you're not so good at, and then after that it's probably best to start focusing on particular specialties that are troublesome. That way, if you get a paper that's, let's say, more cardiology heavy or more psychiatry heavy, you're still covered. You don't want to do questions that feel good to do because you're good at them, because that's not really going to help you in the long run. This examination is marked, well, you get a mark for everything you get right. It's not negatively marked, and depending on what specialty you've applied for, they actually rank this exam differently. So I will speak about GP and psychiatry, because those are the 2 that I know which were relevant to me. So for GP, they take your score, I guess it's standardized against everyone else, and then you get put into a band. So you're either band 1 to 4. Usually the cutoff is band 2. You want to probably score about band 3 and above if you really want to get your first choices or the places that you really want to go to. But other ones, I think they also did the same thing, but there's not bands for psychiatry. You were just ranked between all the applicants and they just tell you what rank number you are. So in summary, so have plenty of time, know what specialty you're applying for, know what examinations they require. My suggested question bank was past medicine. This is the one I've used in medical school and here, and I managed to get band 3, so which was not too shabby. Past medicine, you have 6 months, which will cost you £30, or you can have 4 months, which will cost you £25. If you have any questions about the multi-specialty recruitment assessment, especially relating to psychiatry and GP, let me know.